Yes, you, the one who's been quietly worrying about someone special in your life. Maybe it's your husband, your partner, or someone you care about deeply. You've noticed changes, haven't you? Maybe he's getting up more at night to use the bathroom. Or he seems tired, less like himself. And deep down, you're wondering, could it be his prostate? Could something as personal as his habits, like masturbation, be affecting him now that he's over 60? Let's talk about it. Not in a cold, clinical way, but like we're sitting down together, sharing a cup of tea, and figuring this out as friends. Because this matters. Your loved one's health matters. And what you're about to learn could change the way you both approach his wellness. Did you know that after 60, a man's prostate goes through changes that can be influenced by things we don't always talk about? Things like, well, masturbation. Yes, I said it. And no, it's not taboo, it's science. But here's the kicker. What happens to his prostate when he does this after 60 might surprise you. Some changes are good. Some? Not so much. And there are 6 specific shifts you need to know about to protect his health and your peace of mind. Stick with me for the next 15 minutes, because I'm going to walk you through these 6 changes. You'll discover what's normal, what's not, and one simple thing you can do to support him, something we'll reveal in the final 20 seconds. Trust me, you won't want to miss it. This isn't just information, it's a wake-up call that could make all the difference. So, grab a notebook, get comfy, and let's dive in. Have you ever wondered why some men seem to age gracefully while others struggle with health issues they never saw coming? Could something as private as masturbation be part of the puzzle? Let's find out together. Let's start with a story. Mrs. Laurie, a 62-year-old woman. She's been married to David for 35 years. David is 65, still active, loves his morning walks and tinkering in the garden. But lately, Laurie's noticed something. David's been waking up 2, sometimes 3 times a night to use the bathroom. He brushes it off, saying, "It's just age," but Laurie's not so sure. She's heard whispers about prostate issues, and she's starting to wonder if David's private habits, like masturbation, could be playing a role. Sound familiar? Maybe you've seen the same signs in someone you love. A little hesitation when they talk about their health. A shrug when you ask if they're okay. It's easy to ignore, but here's the truth. After 60, a man's prostate is like a ticking clock. It's changing, whether he notices or not. And masturbation? It's one piece of a much bigger picture. According to the World Health Organization, prostate health becomes a critical focus for men over 60, as the risk of conditions like benign prostatic hyperplasia, or BPH, increases. The American Cancer Society also notes that prostate cancer is one of the most common cancers in men over this age. But don't panic, not every sign is cancer. That's why understanding these 6 changes is so important. Let's break them down, step by step, so you can feel empowered, not overwhelmed. Change number 1. Prostate size and BPH risk. First, let's talk about size. No, not that size, the prostate. As men age, their prostate naturally grows. It's called benign prostatic hyperplasia, or BPH, and it's not cancer. But it can cause symptoms like frequent urination or a weak stream. Now, here's where masturbation comes in. Some studies, like one from Harvard Medical School, suggest that regular ejaculation, whether through sex or masturbation, might lower the risk of BPH by keeping the prostate active. But after 60, the benefits taper off if other factors, like poor diet or stress, are at play. Think about David. If he's been eating too many fried spring rolls and skipping his veggies, his prostate might be feeling the strain. Have you noticed your loved one's habits lately? Change number 2. Hormone shifts. Next, hormones. After 60, a man's testosterone levels drop, while other hormones, like estrogen, can rise slightly. This shift can affect the prostate, making it more sensitive to inflammation. Masturbation doesn't directly cause this, but it can influence hormone balance indirectly. A 2016 study in European Urology found that frequent ejaculation in younger years might stabilize hormones later in life. But after 60? the effect is less clear. Too much or too little activity could tip the balance. It's like walking a tightrope. You want him to feel good, but you also want his body to stay in harmony. Have you ever wondered if his mood swings or fatigue could be tied to this? Change number 3. Blood flow and prostate health. Here's a brighter note. Masturbation can boost blood flow to the pelvic area, which is great for prostate health. Good circulation helps reduce inflammation and keeps tissues healthy. The catch? After 60, blood vessels naturally stiffen, so the benefits might not be as strong. According to the Mayo Clinic, staying active, through exercise or even moderate sexual activity, can support this process. So, maybe encourage him to join you for an evening walk. It's not just about the prostate, it's about staying connected, too. Change number 4. Risk of prostatitis. Now, let's talk about prostatitis, inflammation of the prostate. It's not always caused by infection, but it can be painful and lead to symptoms like burning during urination. Some urologists believe that infrequent ejaculation can cause fluid buildup, increasing inflammation risk. But after 60, excessive masturbation without proper hygiene could also irritate the area. It's a delicate balance. If he's been complaining about discomfort, don't jump to conclusions. It's not always serious, but it's worth a conversation with a doctor. Change number 5. Prostate cancer risk. This is the one we all dread: cancer. The American Cancer Society says prostate cancer risk rises after 60, but masturbation's role is controversial. A 2016 Harvard study found that men who ejaculated frequently in their 20s and 30s had a lower risk of prostate cancer later. But after 60, the data is murkier. Overdoing it might stress the prostate, while too little activity could let toxins build up. The key? Moderation. Here's the good news. Regular checkups can catch issues early. Have you reminded him to schedule that PSA test? Change number 6. Emotional and mental impact. Finally, let's talk about the heart, not the organ, but his emotions. After 60, men often feel pressure to perform or stay youthful. Masturbation can be a healthy outlet, reducing stress and boosting mood. But if it becomes a source of guilt or obsession, it can backfire, affecting his confidence and your relationship. Lori noticed Min seemed distant, not just physically but emotionally. She didn't know how to bring it up. Have you felt that, too? That quiet worry that something's off, but you're not sure how to help. These 6 changes: size, hormones, blood flow, inflammation, cancer risk, and emotions, are real. They're happening right now, whether you see them or not. But you're not powerless. There's one simple thing you can do to support him, and I'll share it soon. First, let's reflect. Have any of these signs shown up in your life? Are you seeing yourself, or him, in this? Stay with me, because we're about to wrap this up with something you can act on today. Something small, but powerful. You made it to the end, and I'm so glad you did. Let's take a moment to breathe. We've uncovered 6 changes that happen to the prostate after 60, especially when it comes to masturbation. From BPH to hormones to emotional health, you now know what to watch for. You're not just a bystander, you're a partner in his wellness. Remember these key points. The prostate grows with age, hormones shift, blood flow matters, inflammation can sneak up, cancer risk is real but manageable, and his emotions are part of the equation. If you see signs like frequent urination, discomfort, or mood changes, don't ignore them. Encourage a doctor's visit. It's not about fear, it's about care. And that one simple thing you can do? Start a conversation. Yes, it's that easy. Tonight, over dinner, ask him how he's feeling. Share what you've learned here, not to lecture, but to show you care. Say, I heard something interesting about prostate health. Can we talk about it? That small step could lead to a checkup, a lifestyle change, or just a deeper connection. If this video spoke to you, hit that like button, share it with someone who needs to hear this, and subscribe to VICOM. Be the first to get our daily videos packed with real, useful insights to help you and your loved ones thrive. Drop a comment below. Tell us what surprised you or what you're going to do next. We read every single one. Thank you for being here, for caring enough to listen. See you in the next video.